Steiner. Are you prepared, Senator, or do you need a minute? You got it? Okay. When you're ready, sir.
Thank you very much, Madam Chair. Colleagues, I'm here to present Senate Bill 1012, which will provide regulated, supervised access for people 21 and older to certain psychedelic substances under the supervision of a licensed and trained facilitator. SB 1012 is a narrower version of what the legislature passed last year, Senate Bill 58, which was supported by a majority of the members of this committee. Thank you, colleagues, which would have broadly decriminalized personal possession and use of certain psychedelics. As you may recall, the governor vetoed SB 58, and in his veto message called on the legislature to send him a bill focusing on therapeutic use of psychedelics. We immediately got to work within a matter of days, and that work ultimately resulted in SB 12. And I apologize for my allergies and my voice sounds a little weird.
It's very Sacramento of you.
Yes. And we worked with a broad array of stakeholders, including opponents of SB 58, who are now supporting this effort, and you will hear from one such person today. SB 1012's support coalition includes combat veterans, first responders, healthcare experts, and a coalition of parents who tragically lost children who use psychedelics and who are telling us that SB 1012 will reduce the risks of other parents suffering that unimaginable loss. SB 1012, under SB 1012, the state will license trained psychedelic facilitators who will then be authorized to supervise and facilitate consumption of these psychedelics, governed by professional oversight and guidelines. People seeking this supervised use will not be able to bring their own psychedelics, nor will they be able to take the psychedelics away after the session. Rather, they will use with the facilitator and only in that session. I do want to know, and I want to thank Senator Menjivar and Senator Glazer for working with us. And based on those conversations, I'm committing to amend the bill to limit the licensure to be a facilitator to existing mental or existing licensed health providers specifically, and I'll just list them out, to physicians, including but not limited to psychiatrists, psychologists, marriage and family therapists, licensed clinical social workers, nurse practitioners, physician assistants, licensed professional clinical counselors, and licensed drug and alcohol counselors. So those will be the only individuals who will be able to go and seek a license. They'll still have to get the training and receive the license to be able to do this, but it will not go beyond that existing category of license holders. SB 1012 also contains provisions to expand education so that people know how to use psychedelics more safely. This was very important for our coalition. Public education around psychedelics is extremely important because these substances, like any powerful substance, and they are powerful, includes risks. Both those facilitating and those using must be aware of those potential harms and how to reduce that risk. Growing science shows that these substances can change people's lives. The FDA is anticipated to approve one or more psychedelic therapy in the coming years. However, as indicated in the response to the committee analysis by Dr. Brian Anderson, that authorization is likely to be quite limited to a limited number of providers with DEA authorization and for a limited category of diagnoses. It will be a positive step forward, but having that complemented with this bill is incredibly important in terms of expanding access. This bill is a culmination of about almost 4 years of work. It's been a real journey, and I think we have a very strong work product here. Obviously, as with any complicated area, there's always more work to be done. This is the first policy hearing, and I'm asking the committee to give me the opportunity to continue to do this work. Many people are currently using psychedelics today. They're doing so in the shadows since we criminalize their use. Many people are doing it in California. Many people are being forced to travel to other countries to receive this facilitation. Let's bring it out of the shadows into the sunlight and help people use psychedelics more safely in a structured setting. I respectfully ask for an aye vote. With me here today to testify are Jason Moore Brown, a United States Army veteran with the Heroic Hearts Project, which is one of our sponsors, and Susan Segui, the Executive Director of the California Coalition for Psychedelic Safety and Education.
Okay, so to the two of you, I'll have 2 minutes each, and I assume whoever else is here for technical support if there are questions. All right, go ahead.
Madam Chair, members of the committee, fellow veterans, including Senators Archuleta, Menjivar, and Roth, good afternoon. My name is Jason Moore Brown. I'm a member of the Veterans Mental Health Leadership Coalition and an ambassador for the Heroic Hearts Project, the bill sponsor. I am here on their behalf and on behalf of the 1.8 million veterans that comprise your constituencies.
Sir, you forgot Senator Eggman, our
Senator
fellow
Eggman,
veteran.
I apologize. I thought I did my research. I'll work on that, but I apologize. Thank you. I'm here on behalf of the 1.8 million veterans that comprise your constituencies, asking you to vote yes today on SB 1012. I live in Placer County with my beautiful wife and 5 children and my granddaughter. I served with distinction as an Army officer from 2000 to 2008, deployed 3 times in support of the global war on terror. During that time, I successfully conducted over 300 combat missions. Statistically, I should have been killed 15 times. I received 2 Bronze Stars for my actions in combat. General William Tecumseh Sherman said war is hell. I realized how true that statement was during the invasion of Iraq in 2003. Honestly, it's frustrating to be sitting here before you all again with my hat in my hand, reliving my story and pleading with you all, asking for your support. Support that will give California veterans like me a pathway to the only thing that has provided many in our community with any long-lasting relief, and that's psychedelics. Sometimes we are called to be brave and do hard things, so here I sit. Here is the reality of the situation and some facts. Over 133,000 veterans have committed suicide in this country between 2001 and 2021. In 2021, veteran suicides in California accounted for over 11.5% of all of the suicides in this state. California has the largest U.S. veteran population in the United States. I took ayahuasca with other veterans at a Heroic Hearts retreat in Peru a year ago, and it's the only thing that has helped me find peace in the 21 years since I first experienced war. My wife was so moved by the transformation that she, dealing with her own traumas, some inflicted by me, took psilocybin in Mexico at a Heroic Hearts retreat with other veteran spouses. She had also sought relief via different modalities, and nothing was as therapeutic as the psychedelics. If SB 1012 were enacted, my wife and I would not have had to travel outside the country to access this life-saving medicine. Nothing currently available to veterans has shown the potential to decrease suicides and improve mental health like psychedelics. If there were other better options, I wouldn't be sitting here in front of you today. So let's please put aside politics, personal misgivings, and look at what's available in research and the other legislation that's passed in other states and at the national level and move this bill. If you want to thank veterans for their service, you'll vote yes on SB 1012 today. Today, I challenge you all to be brave and sit here with me and my colleagues, and let's do the hard things together. On behalf of the veterans in California, we thank you for your service.
All right, thank you for being here today. Go ahead, 2 minutes.
Thank you. Good afternoon, Senators. I'm Susan Segui, representing my family and the Coalition for Psychedelic Safety and Education. Losing my 21-year-old child to distressing experience with psilocybin drives me here today to support a bill that will create safeguards that will provide regulated access and increased awareness of the risks of psychedelics through public education. My child was a trapeze instructor, held a full-time job, and had a future at UC Davis, and tragically passed away after using psilocybin alone. It was all captured on a video, so we know exactly what happened. The prevailing online narrative that I was seeing before and after my child's death highlighted the potential benefits of these substances without really mentioning much about the risks. I didn't think it was such a bad idea for her to try it. I am not alone. Several of the parents in our coalition have lost children to psychedelic use, and others have children that are struggling after having adverse events. What bonds us and binds us is not just our struggles and loss, but our belief that psychedelics, taken in a responsible manner, the right way with proper screening and facilitation can be very helpful to many people. What also binds us is the knowledge that psychedelics are being used right now. And they're being used in an increasingly large rate, and that is not going to stop. And they're being used by the most vulnerable in our communities, people with mental health conditions, youth, young adults. When there's an increase in use, there's just going to be a increase in harms. I had a conversation with a 16-year-old recently who told me that psychedelics are used and very prevalent in her high school. Amazing. This increase in use will not stop, so we need safeguards, like 1, regulated access, and 2, we need public education. We need to be able to have balanced messaging about the risks of psychedelics as well as the benefits. And that balanced narrative did not exist when my child tried psilocybin. Last year, our coalition opposed SB 58 because we would never support a bill that created a marketplace or allowed for unregulated use. So today, if you don't approve this bill, we're just going to be where we are today. Had HB 1012 existed when my child took psilocybin, they may have been able to discuss that interest with a therapist or a counselor, and they may have been told to get a safety screening, been told to use the substances not alone. But that would not happen without SB 1012, because a counselor or a therapist would be afraid to counsel a youth about the use of a substance that wasn't legal.
Do you have a final, can you capture your final thought there?
Yes. We urge you to please approve SB 1012 today to fund. It's a bill that provides for a fund for public education about the risks of these very powerful substances and how they can be used safely, and it also provides a regulated framework for use.
Thank you for being here. Okay, we've reached the part where folks who are in support of SB 1012 but would like to offer their Me Too testimony, name, and affiliation, position on the bill.
Thank you, Madam Chair. Anthony Molina on behalf of New Approach Advocacy, LEAP Law Enforcement Action Partnership, the Steinberg Institute, and the Sacramento Institute for Psychotherapy in support. Thank you very much.
I'm Krishit Koja. I'm Director of Policy for Veterans Exploring Treatment Solutions. We're a 501c3, and we are a co-sponsor of the bill as well, and we urge you to vote yes. Thank you.
Hi, my name is Isaac Gilmore. I'm a native Californian and former Navy SEAL. I'm on here on behalf of HHP. I was part of Treat California last year to add out to our coalition. I both received benefit from, and I've advocated for the use of these medicines across the country. And to our generation of warfighters, psychedelics means hope.
Thank you. Need folks to just stick to your name and organization, please.
My name is Angela Graham. I was a firefighter for 17 years, and I have co-founded the Siren Project, which provides entheogenic medicines for first responders.
In support.
In support, yes.
Good afternoon, Nara Dalbaca, Vice Chair of the Lake County Democrats. I'm here on behalf of the Lake County Democrats, the Alameda County Democrats, the Los Angeles Democrats, Sonoma County Democrats, Monterey County Supervisor Wendy Root Askew, several members of the Berkeley City Council, Any Positive Change, a harm reduction program, Michael Buhman, founder of Red Dot, an organization that treats PTSD and first responders, Cosmovisiones Ancestrales, a community-based research designing public health interventions for violence, injury, and disaster prevention, and Dr. Bronner Soaps Foundation, all in strong support of the bill.
Thank you.
Hi there. Good afternoon. Ismail Ali on behalf of the Multidisciplinary Association for Psychedelic Studies in support. Thank you.
Thank you.
Rebecca Nieves McGoldrick, a mom, an associate marriage and family therapist, and also on behalf of A New Path, which submitted a letter in support.
All right, thank you. That's everybody for support. All right, then we'll take opposition. If there's lead opposition, you come on forward. In fact, I'm going to ask the folks to step down so they can come forward and have the seats. We'll just have a changing of the guard here.
Or you can, two of you can stay up.
Go ahead and have a seat. All right, and then you will also each have 2 minutes. When you're ready. Nope, we need you to push the button first.
That.
That's better.
Great. Chair and members, my name is Greg Birch. I'm the Vice President of the California Family Council. And we have some grave concerns about the harm this bill will cause to our state citizens. There's no reason to doubt the sincerity of the veterans and others here today, desperate for better treatment for mental health issues like PTSD. But notice Senator Wiener didn't talk much or seriously about all the veterans and others whose conditions were only made worse by these drugs, or who were rushed to the hospital with heart issues, seizures, amnesia, acute anxiety, or hallucinations. As acknowledged in the bill analysis, a recent Stanford study said that California hospitalizations and emergency department visits related to hallucinogen use increased by more than 50% between 2016 and 2022. What do you think is going to happen if California tells the public that psychedelics are safe? Everyone wants to help veterans who have sacrificed their lives in service to our country. We owe them a great debt of gratitude. But make sure your emotions are not being manipulated in service of Senator Wiener's grand plan to end the war on drugs, on all illegal drugs. In 2020, Senator Wiener wrote the following on his Twitter account, and I quote, "To be clear, decriminalizing psychedelics is simply one step in ending the war on drugs. We ultimately need to decriminalize all drug use and stop putting people in prison or drug use or possession. We are working on all of this, but for now, let's get it done with psychedelics."
Do you have because we need you to do a final wrap thought here.
All right. Well, this bill really isn't about science. It's about skipping science. Senator Wiener doesn't want you to go through the normal scientific process our state legislators or federal legislators already set up to make sure that drugs used for the public are safe. He wants psychedelics to skip the strict scientific standards, but to do so, he needs you to create an approval system that doesn't even require a psychedelic facilitator to have medical training before trying to help a veteran struggling with PTSD or other mental health issues. Okay. And for these reasons, we oppose.
All right. Thank you very much. All right.
Briefly, Madam Chair.
Yeah, thanks.
I'm Ryan Sherman with the California Narcotic Officers Association in opposition to the bill in print, and also today representing other police officer groups in opposition, including the Riverside Sheriff's Association, California Reserve Peace Officers, California Coalition of School Safety Professionals, Deputy Sheriff's Association Monterey and Placer Counties, and police officer associations of Arcadia, Burbank, Claremont, Corona, Culver City, Fullerton, Murrieta, Newport Beach, Novato, Palos Verdes, Pomona, Riverside, Santa Ana, and Upland. I want to start off by just thanking the senator for taking the amendments, or pledging to take the amendments to limit the facilitators and their background and their training and experience. We still have some concerns about the drug and alcohol counselors because their licensing is a little bit different. So we do have some concerns there, but we do appreciate his efforts. We also would respectfully request that ecstasy be removed from the bill as it was in SB 58. That passed last year. It did not include, the final version did not include ecstasy, and we think that's still a big problem to have be dispensed by non-medical personnel. It's still Schedule 1. Adderall, is a pretty common drug, and it's dispensed only by licensed medical professionals. It's a Schedule 2. This is Schedule 1, and it'll be able to be dispensed by non-medical folks. So for those and other reasons, look forward to working with the author, and hopefully we'll be able to get to some kind of agreement. Thank you.
All right. Are there other folks in the room in opposition? Now would be the time to come forward. Tell us your name, organization, and position.
Thank you, Madam Chair. If I could do concerns, as noted in your analysis, Paul Yoder on behalf of the California State Association of Psychiatrists who have had concerns. We're talking to the center on a regular basis, inviting the proponents to be at our next meeting Thursday night. We'll just keep working with him, see what we can do with this, but appreciate the amendment, Senator. Thank you.
All right, thank you. Any other in opposition or concern? All right, then we will come back to the dais for conversation with colleagues. You want to start out Archuleta and then Senator Eggman after that?
Thank you, Senator, again for bringing this forward. I know I've been with you on this journey, oftentimes on the opposite side, as you know. My law enforcement background, my service with the 82nd Airborne. As a combat veteran, I was very, very tough on you as you started your journey. But over time, I've gotten closer and closer to you and understanding what you were trying to do, help veterans who really need it. But I think what's really taken me over the top today is the fact that you've listed all these professionals that are here in the dais with us that are going to be part of that. And let's just for a second, it's not going to be on the streets. It's not going to be there where anyone can just buy it. It's going to be supervised by these professionals, and only if they meet the criteria, because not every veteran is in need of the psychedelic drug. There's counseling, and I think you assured me there will be steps and procedures when you finally get to that point where the professional says, I think we need to try this in small amounts and then go from there. And we heard the testimony of a veteran that changed his life. So I think we're in the right track, and I think that this will help our veterans. And in reference to our first responders, we have law enforcement officers, firefighters, who experience things that are pretty equal to combat, and their lives are turned upside down. So now we're opening the doors for them too. So for all these reasons, I'm going to support it, and let's continue the research, and let's continue opening the doors to bring our veterans home. Thank you, and thank you for your service.
Senator Eggman.
Thank you very much. So this is a big, ambitious bill, setting up three different new division, a board, and an oversight committee. And so the responsibility for setting up what the criteria is for the education to become a licensed person will be established by the division, as I understand it, and then those folks will be supervised by the board, which will then be. So can you talk a little bit about that, and also about the issue of dispensing? I've heard about dispensing, but I don't see anything here that pertains essentially to that.
So the board will essentially be like the equivalent of the medical board or the dental board in terms of the licensure. The division will help set the actual standards, and that will also include the cultivation manufacturing, so that's being done. And we know that will require, we want that to have that regulatory oversight, because again, as I said at the beginning, this isn't about people taking something from the street and bringing it in or taking it with them. It's a very controlled setting. I want to, and then we of course want to make sure that people who are these existing licensees who then get this additional licensure are that very clear training standards are in place, and professional conduct, and making sure that people who act inappropriately or violate the law are held accountable for that. I do want to just say, we of course, this is the first committee. We know that the regulatory structure, especially as we have been communicating and reaching out to the administration, and I imagine at some point they will have an opinion, I'm assuming, about how that should look, and so we look forward to continuing that work.
And we haven't been to the appropriations yet, but what are you thinking about costs? And we're talking about a budget year like this year.
Yes, and I this year am acutely aware. I wish I were budget chair during a mega surplus year, but alas. We will of course be working on cost savings for appropriations, and we started working right after the veto last year. Obviously things moved in a certain direction, and that's something we're going to have to deal with and address.
Contend with, and I would guess this is going to take a couple of years to set up. I mean, as somebody with a license, I wouldn't feel comfortable getting another license, because then you put your primary license at risk.
Yeah, it's a multi-year implementation, and and then the training that they set up, this will be a gradual ramp up for sure. Thank you.
Senator Wynn, and then come to this side of the room.
Thank you, Madam Chair. I just have one question. Is there any requirement for, if a medical diagnosis occur, is it required to receive psychedelic treatment or therapy? Do we need a medical diagnosed to receive it?
A formal diagnosis. Now, there is a process set up for evaluation. So again, these individuals will have to undergo, even if they're currently a psychiatrist, they'll have to go through the training to receive this license, and they will have to make an evaluation, and there's a whole process laid out in the bill for what they have to do beforehand, what they have to do afterwards. So it's not just like I walk in and say I want this, and so they get it. There's a whole process before and after, because after is important as well.
So a formal diagnose, just like we would if we were to get any other treatments.
Not exactly the same,
Okay.
but there is a screening that has to happen beforehand, and that's laid out in the bill. And the board would also have the ability to make its own rules.
Okay, thank you.
Okay, just one point here to my colleagues. We have floor session in 15 minutes. So I'm trying to gauge if you want to stop here and come back with comments. There are at least 5 of you with your hands still raised to speak. And I know it takes us a few minutes to get over there, and I'm not sure how many of you need to go upstairs to grab items. So just gauging across the board. Would you like to stop here? Yeah? Okay. All right. We're going to recess then, and we'll come back after session and finish out this bill. So sorry to everyone.
Thank you, colleagues.
Sorry. Okay, we're going to go ahead and get started, call the meeting back to order. We have heard from the author on Senate Bill 1012. We've heard from the support and the opposition, and we've heard Me Too testimony. We've heard from a few members of this dais, and we are coming back to this dais. We're going to start with Senator Roth and then go to Senator Becker.
Thank you, Madam Chair. As the author knows, I have some issues with the bill, which I know he will continue to work on when the bill moves out of this committee and address those. Some of the opposition's concerns, frankly, should be alleviated by shifting the bill toward clinicians in a therapeutic setting, which, as I understand it, is what the governor wanted to begin with. I think that's a good thing. I have had some concerns utilizing the DCA board structure in this context, but it seems to me that, Senator, since you've listed a number of licensed healthcare providers as the ones who will be providing this therapeutic engagement with the psychedelics, instead of setting up a separate board for purposes of licensure, I wonder if it wouldn't be more cost effective to build these items into the scope of practice that those individual licensees have under the boards that do regulate them. This being simply in addition to the activity that they are licensed to perform by their own boards.
Did you want to?
That's a question.
Okay, great. Sure.
I think I said I wonder if. Yeah. I didn't phrase it like we were taught to be
question mark.
As lawyers, right?
I think given the amendment that I've committed to, that is certainly something we will take a look at. We'll have to sort of look at the details of it, but I appreciate that idea.
Good. Keep me posted. Thank you, Madam Chair.
Okay, Senator Becker.
Thank you. I'll kind of keep it brief because I know folks of other committees are trying to get to. I'll just say that appreciate the testimony, and over the course of this bill, over a number of years, have heard a lot of similar testimony, and including my own district, there was a large event. There's a whole movie kind of about this, and what these kind of therapies have done for veterans. And I'll note that I think it's something like almost 50% of the new mental health therapies that are going through approval right now are psychedelics based. So that's been another piece of this too, is making sure we can actually do the research and work towards this. So I just appreciate the author's efforts to really take the governor's feedback into account and really work on making this into something that kind of works with our health system. And I appreciate it. I'll be supporting the bill today, and I'll move it when appropriate.
Okay. We're going to go to Senator Eggman and then Menjivar, and I have Dodd on here too, but I think he had to present somewhere else. We'll see if he gets back in time.
Thank you, and I know I'm coming back at this twice, but just a question, because you've delineated out all the professions who can be monitored. Now, say I apply for that, then I can prescribe. I don't have prescribing powers currently. So how do you get around that?
Well, it's not about the prescribing. I mean, ultimately, when the FDA, whenever it gets around to providing some limited, prescribing access, that'll be prescription. This is about facilitation. And so what we're saying with the amendments today is that the facilitators will be limited to this pool of people who already have mental health related or the listed licensures. They will then be able to obtain this additional license to be able to facilitate. And so it's not a prescription per se. That is something that people do based on FDA approval. It's facilitation. So I don't know if that makes sense.
I mean, I hear what you're saying, but I think that bears more looking at as you move along.
Yep. Thank you.
Senator Menjivar, do you want to be heard?
Thank you so much, Senator. We spent a lot of time over the weekend checking in on this, and I really, really do appreciate in your talking points you committed to some of the things that we talked about. And I know there's still going to be additional work on it, because I think what Senator Eggman brought up is a key thing. But I wanted to point out to some of the stuff that still is on my mind. First is the ecstasy still being included in the bill. I know that was one thing that wasn't in the bill last year. And then of the levels that you pulled out, there's one that is in graduate level, which is the substance abuse counselor. That is one level that still worries me, because that is not a license, but rather a certificate, and it's not related. It's more peer versus therapeutic. And then, just to clarify, with this delegation of certain licensees, the board you're looking to create would still come up with the training for these individuals.
Yes.
Okay. And do you anticipate, and maybe that's for a later one, because I mean, so many potential questions coming up. I just wanted to, I'll back up a little because it's going to take a lot of additional work. I just wanted to make those 3 points.
I have some comments too, so Senator Menjivar, if you want to speak again after that, I'll take another pass through. So, first of all, right off the bat, I just want to thank everybody involved in the bill. These conversations actually predate me on in this role as chairperson. I know Senator Roth started the dialogue here or was in the seat when it first started. And I want to thank the staff of the Business Professions Economic Development team who have, along with all the other bills, worked really hard to meet with the sponsors, meet with the author, my own staff, who are some of your favorites, meeting with you, and with the sponsors many times. So this is a big, big bill, and that may be one of the reasons why there's a little bit of hesitation. I have a lot of concerns with the bill. I know you know this. I issued a no recommendation on this. It's the only one. And I would like to be clear about why I did, and then however folks vote, they vote. And you've been great to work with for me on this bill. But first of all, I feel strongly that this is a marketplace bill. It can be nothing other than a marketplace bill when it calls for setting regulations for, and this is directly from the bill itself, production, distribution, transportation, storage, processing, manufacturing, testing, quality control, sale, licensure, locations of the storefronts, transportation delivery regulations, and self-collection of aggregate data. That is like the definition of a marketplace bill, because it sets everything from manufacturing to point of sale and all of the components in between. And how does it set that marketplace? It sets it by creating 3 new tiers of government: a new agency-level division inside of the Department of Consumer Affairs, a new 9-person board of regulated psychedelic facilitators, and a new 14-member oversight committee, all of which are supposed to be done in time for 4/25, so next year, April, for this to be in place. So for folks who said multi-year, no, it's 4/25 is the date written into the bill. And these 3 new tiers of government would be wholly in charge. They decide who gets the license, they decide what it takes to get the license, they decide where the sites go, they decide everything from point A to point of sale. The board creates new standards for administration of psychedelic drugs. It does not include access to medical records. At this point, it does not. This would be an individual comes in and they voluntarily tell you what their medical records are. There's no HIPAA component to this, so there's no ability to look at the person's medical records to see when the last time they went to a different location or what doctor they're seeing for what other services. It does not necessitate clinical or medical professional engagement. And I hear the author saying he's going to take some amendments on that point today. I think largely having heard from a couple of folks who have backgrounds in that space. I am concerned even with the amendment that it does drop to a level below even a master's degree and doesn't necessarily include medical professionals still. It establishes full hiring, firing, education, and scope of psychedelic facilities all underneath that board. This is no longer about one population. Previous iterations of the bill were very focused on one iteration that we did hear from today. This is about everybody from 21 and up throughout the entire state of California. There is no local control left on the bill. All cities and all counties is the language written into the bill right now. And cities and counties could not add an additional licensure requirement. In other words, if I'm in the city of Sacramento and the board decides they're going to open one of these here, I cannot, as the city of Sacramento, add a security license or any other form of license that the city of Sacramento would normally add on some of the other similar type businesses. Transportation is also enshrined, meaning transportation through cities and counties. As the bill was written now, there are no licensed therapists, no pharmacists, no doctors, and no medical records. Included substances, and most of these names are too difficult for me to pronounce. We'd have to go back a couple of hearing items, get one of those pharmacists in here for me to have some help to be able to pronounce these. But it does include DMT, mescaline, MDMA, which is the one that you've heard quite a few people talk about today. Street names for MDMA are ecstasy, Molly, and Mandy in its crystal form, and psychosaline, which is shrooms. Mescaline street name is peyote. These are, most of them, including all of the MDMA drugs, are Schedule I drugs. Schedule I drugs are defined by 3 criteria. They have to meet all 3. High potential for abuse, no current acceptable medical use in treatment, and lack of safety even if under medical supervision. So these drugs currently are listed there. This bill creates an entire new government structure to establish statewide marketplace sale, distribution, and manufacturing of psychedelic hallucinogenics, currently deemed unacceptable under Schedule I, too dangerous, even under a medical professional's care. It took many years in the state of California lots of research, lots of dialogue to make marijuana legal just for medicinal purposes. And then many years beyond that for marijuana to become the marketplace that it is now, which still includes cities and counties having the ability to opt out. This bill, introduced in the second year of a 2-year session, seeks to shortcut all of those dialogues. I will say, to the author's credit, it's not his first go round. He didn't just bring it up. He's worked on it over several years, and here's where he is now. But it may well warrant a longer discussion with more input and a lot more stakeholders. This doesn't include the voters, which I worry about deeply. It jumps directly to storefront business, mandated in every city and county with no opt-out provisions. In my opinion, it is too much, too fast, with too little input, and too little medical participation. So I will be voting no. Colleagues, any other comments? Senator Smallwood-Cuevas?
I just want to thank the author for being vigilant in this process. And I think from the conversations that we've had about this bill, things that will provide relief and care, things that help members of our community save lives. We're going to struggle through this to make sure that we're doing everything that we can to protect those, and particularly those who have given so much. So, I want to say that, I see the long list of support, for this bill. And I think we can figure this out and allow this bill to continue to move forward and address these questions that have come up, and your willingness to work with so many to make sure that we get this right. Because at the end of the day, it is about saving people's lives. It's about looking at innovation of care that can make a difference. And so with that, I hear the questions of my colleagues. We talked about this bill, but I think we will continue to discuss it. It's being double referred, so there will be another committee that will look at this and help us get it to where it needs to be. And so I look forward to seeing where this bill goes and making sure that we get it right in the state of California.
Senator Menjivar, and then Senator Dodd.
Thank you, Madam Chair. Senator, you heard even last year I had a lot of concerns with this bill. I did believe that this item or drug should be approached through a prescription and therapeutic approach. I know currently right now there are certifications that exist, training at a minimum of 8 months for a lot of licensed clinical individuals just to get trained on this for the future of approving these items. I know the mental health field is preparing for this, and the main thing that really pulled me is seeing my brothers and sisters suffering, who needed this to address a lot of PTSD. Now, I still have a laundry list of concerns because years ago when we talked about medicinal marijuana, we talked about how it wasn't going to be addictive. And now we're seeing kids addicted to marijuana who are in treatment. And I do worry that this will get to that level. My actual stance on this is that I would want to refrain it to prescription only and not public use whatsoever. I do worry about storefronts because most of the time those are always in communities of color. I do have the concerns of who's going to be allowed to give this out and so forth. But if there is an ability to bring some relief to a lot of individuals, like our first responders, the firefighter that we heard speak today, the police officers that I've spoken to, our veterans, I think for right now it outweighs right now, the cons, to provide you the ability to work with the laundry list of stakeholders you have around the table to come up with something that works. Now, I've said it to you and I'll say it here. I will 100% not vote for this bill on the floor if there isn't movement to get to a place that is more clear, that perhaps trims the bill because it is a heavy bill. And I don't think it'll be ready by next year, but moves us in the right direction. I want to make sure we do this right.
Okay, Senator Dodd.
Yes, thank you very much, Madam Chair. First of all, I appreciate your comments. I'm a co-author on this bill this year, and I've been supportive of this bill. With people mad at me, people happy with me, all along the way. And it was like 4 years ago when the first bill came out, I was solid no. And then I had an opportunity on the phone on the way into the committee hearing to talk to the advocates, particularly those advocates, helping veterans. And they changed my mind. They absolutely changed my mind about how I felt about this bill and what this bill could be. I have a lot of respect for the people around the room that have just given comments, and I don't disagree with some of those comments. And I would agree that Senator Wien, the governor vetoing this bill last year and then setting out some provisions under which he would not veto one actually even made it harder for you, I think, this year. But I've got the confidence, that Senator Wiener is going to work this bill and do the type of things he's got to do to get this bill in shape as we move to the future. This is the first policy bill, and notwithstanding, I still think there's ample time for him to work a lot of these things out. Respectfully ask for your aye vote.
Senator Archuleta.
Well, first off, again, I'd like to thank the senator and the veterans and everyone in the room who are fighting for us, veterans. But, Madam Chair, I've got to hand it to you. Your presentation just a few minutes ago that I think releases us from actually voting with the chair or giving us the opportunity to vote against the chair. And I appreciate that. And I said earlier that I'm going to support the bill because I know the work you've done. I will continue to do that. But you also have to come back at us with enormous changes because of things that the chair just laid out, the things that our colleagues are laying out. And if it's too soon, too much, hey, take a step back. And if you need to come back again next year, then let's do it. But let's make it a good, solid bill. And we're going to support it because I'm hoping that you're going to be able to put everybody together and look at some of these things that should be the amendments. But I will vote for it right now, and hopefully it'll keep going forward with all the work that's going to be done to help our veterans and help everyone. And some of the things we heard, the fear factor of having a storefront versus really tough clinical psychologists and medical professionals in a professional setting to be able to handle each and every person independently and only with prescriptions and only with a true sense of having that individual feel that they're on their way to being cured. And this just might be one element that'll do it. So again, I will vote yes on it and look forward to seeing all the amendments and the changes when we hit the floor. Thank you.
Senator Dodd.
Yes, with all due respect to Senator Archuleta, I know what you were trying to do there, but no way, shape, or form am I voting against the chair here. I just want to make that clear. I think her arguments were absolutely cogent and very, very well put out there for the author to hear. In my case, as I said, I've already been invested in this bill, and I'm going to allow him some time. But this is not a vote against the chair. It's a vote with the author.
I believe he has a motion from Senator Becker. Is that right, Senator Becker? Would you like to close?
I would, Madam Chair. Thank you very much. Thank you, colleagues, for the robust discussion. And of course, as we always do, we'll continue to work on the bill. I will note that the suspense hearing is 4.5 weeks from today. I don't know when the deadline for amendments is. It's probably about 2 to 3 weeks. And so I also don't want to elevate hopes that we're going to get every piece of feedback we need in the next 2.5 or so weeks to be able to get stuff drafted in the council form and have everything tied a bow around it. Anyone who has ever worked with me before, anyone who has ever chaired a committee that I've worked on knows that I work my rear end off. And I want to just say, for the last 3.5 years, the stakeholders that we have engaged with in this bill, including from law enforcement range, including last year when Ms. Segee and her coalition were very, very vocally opposing my bill, and we met, we engaged, and ultimately this year we worked very hard together to produce a bill that they are now supporting. And so I don't want there to be any impression to the contrary. We work with all stakeholders, people who love what we're doing, the people who don't like what we're doing. There were a few statements I completely respect the chair's opposition. A few things that I just do want to note. First of all, this is not a marketplace bill. Marketplace bill suggests that consumers can just go in and purchase like you can, for example, now with cannabis. This is only available when a licensee has you in to facilitate. You can't bring it in with you. You can't bring it out with you. You can't go into a store. A storefront, I think, is not the right term. This is into a practitioner's office. This is not a store where you go in and just buy and leave with your product. And so I think it's really important to understand that. In terms of cities, the bill is very explicit that cities can adopt time, place, and manner regulations. It's not the case that cities can do nothing. And that is a conversation we're, of course, always open to. In terms of the timetable, the board is required to adopt regulations by 2026. So that's 2 years from now. That's not 2025. A couple other things. It's been pointed out today and in the analysis that this is the second year of a 2-year session. Again, we've been working on this for 4 years, and we think we have a good bill that we'll continue to work on, of course. But I also don't want anyone to walk away with it. This is somehow a poorly constructed bill. This is a very, very thoughtfully constructed bill. Like any thoughtfully constructed bill, there's always more work to do, and we will do that work. There was reference made to the voters, and I'll be honest that the voters passed Prop 64, and that's the law of the land. This legislature has long been incapacitated in actually dealing with cannabis. And so the voters took it into their own hands because the legislature couldn't do it. And what does that mean? That we have a lot less flexibility to tweak and massage and update the law because the legislature failed and did not act. And so the voters did it. And now we are constrained to deal with changing circumstances. How about we not leave it to the voters to deal with it? How about we do what we're supposed to do, which is to acknowledge that there are a huge number of people who are using these substances, including MDMA, right now. And they are doing it in the shadows, and they're doing it at times in ways that are not safe, and they're not getting the education and the information that they need to be safe. And this bill creates an opportunity for people to be able to go to someone and use in a controlled, supervised, structured setting to reduce the risk and obtain benefits while staying alive and staying healthy. That's what this bill creates a path to doing. I look forward to continuing to work. There were no amendments in the analysis today. There are flagging many issues, no amendments, but of course we will continue to work with all stakeholders, and I respectfully ask for an aye vote.
All right, motion and call the roll. This bill, by the way, is due pass to public safety.
Ashby?
No.
Ashby, no. Wynn? No. Wynn, no. Alvarado Gil? Archuleta?
Yes.
Archuleta, aye. Becker? Aye. Becker, aye. Dodd? Aye. Dodd, aye. Eggman? Glazer? Aye. Glazer, aye. Minjavar? Aye. Minjavar, aye. Nilo? Roth? Smallwood Cuevas? Aye. Smallwood Cuevas, aye. Wilk?
No.
Wilk, no.
That is 6 to 3. Sure, we will call the roll one more time.
Alvarado Gil? No. Alvarado Gil, no. Eggman? Nilo? Roth?
6 to 4.
Leave it.
Hold on. All right, we're going to leave it for a moment, leave the roll open for a second, and we're going to come back to, we have a couple of items, I think. Although, yes, we have one item. This is Senator Glazer's bill. No, the only one left open is...
He was not here, and we left it open.
We did?
Yeah.
Okay.
Yeah.
Oh, yes, you're right. Okay, yes, okay. So, no, let's do Senator Glazer's bill, file item 9, SB 1462, Glazer subdivisions. Let's call the roll.
Okay, current vote 6 to 2. Chair voting aye. Vice Chair voting no. Alvarado Gil? Aye. Alvarado Gil, aye. Eggman? Menjivar? Nilo? Roth, okay.
Okay, that is 7 to 2, I believe. That bill is out. One more for you, Senator Glazer. We have file item 1, SB 966.
966.
We already did that.
Current vote's 11 to 0. Glazer? Aye. Glazer, aye. Nilo?
Okay, that one's 12-0. That one gets out, Senator Wiener, and we will come back to SB 1012. We are waiting for one member. Okay, can you state the... Hold on. Okay, you guys, let's finish up here. All right. Can you recall this bill?
Sure. Item number 2, SB 1012. Motion is due pass the Senate Public Safety Committee. Current vote 6 to 4. Chair voting no. Vice Chair voting no. Eggman?
Aye.
Eggman, aye. Nilo? Roth?
Okay, that is 7 to something.
4.
That one gets out. That's it for our agenda today. Thank you, everyone.
Thank you.